Hello, everyone, and welcome, Board of Directors. My name is Erica Penrod. I am the Executive Director of Healthy Community Brookfield. I am very excited about my new role, and let's get started. So today we're going to review Healthy Community Brookfield, or HCB's, improvement plan. Some of the goals are going to be our history, our environment, and our partners. We're going to review a SWOT analysis. That's our strengths, weaknesses, opportunities, and threats. We will also review our strategic direction, our outcomes, as well as our action plan and evaluation. To start with an overview, Healthy Community Brookfield was established in 1998, originally as Brookfield Health. From there, it was a VNA, or Visiting Nursing Agency, and it grew into Healthy Community Brookfield. So serving Brookfield County, it is primarily consisting of agricultural and manufacturing community. We have 97 employees throughout Healthy Community Brookfield Hospital, as well as internally we have program cycles ending and operational things changing. So those are going to be kind of the key points that we'll be hitting on today. So here you have an overview of our programs and services. Some key things to pull out from this list is going to be the duplicate services, which will be teen health and violent prevention, diabetes, and mobile health medical services. So some of those are overlapped, so throughout this next 6 months to a year, we'll look more in depth with a plan for a 3 to 5 year of merging programs and services or ending a program or service. So within our community, one of our major partners is the Department of Brookfield Community. Many of our contracts are through them, which is great and can pose financial instability depending on where we are at with our Public Health Accreditation Board, which we will get later too. Additional partners that really benefit HCB and we try to have a symbiotic relationship with is YMCA, Meals on Wheels, Elder Services, United Way, and Regional Transportation Services, all of which play key roles, specifically highlighting the regional transportation services that really provides community inclusion for all of our residents. So moving on to our environmental, economic, and internal factors that are going to be in need of improvement. Right off the bat, you see allocation of services, approaching inequities and duplicate services, follow-up post-hospitalization care, the extensive financial impact of well water testing, as like we had mentioned before, those duplication of services. So getting into the SWOT analysis, we're really assessing strengths, weaknesses, obviously opportunities and threats, really trying to identify all of those threats that can really do some harm to Healthy Community Brookfield, HCB. So starting with the strengths, some of these observed strengths are they're dedicated and hardworking employees. We have a great repertoire in the community. We are a long-term partner. So being able to provide these programs and services is an asset for us, an asset for the community, as well as our board stability and sustainability. We've had a lot of board members that have been with HCB throughout its transitions. So that definitely provides a lot of stability and familiarity with our company. On the contrary to that, our weaknesses, we have a limited resources, being an agricultural and manufacturing community. There is only so many resources with only those two industries really being the primary ones. Also cross-utilizing employees. So as HCB grew, tasks grew, and we ended up using cross-utilizing employees for different tasks, which can be useful in the short term, but can have long-term detrimental effects and can lead to misallocation of time, efforts, and funds, which is something that HCB has seen over the years and has seen in its patterns and trends. So we're hoping to kind of spearhead that in particularly head on. So then going to opportunities, we have a lot of opportunities for community relations and community support. So building on that and expanding will be very beneficial for HCB and Brookfield County. We can collaborate with these agricultural and manufacturing communities as well as industries, as well as local law enforcement. So local law enforcement had reported that they've seen overlap of different programs and services. So perhaps additional feedback surveys would be beneficial for both parties. as well as an opportunity to reassess our board and our senior management network. So coming from Oregon, we're able to bring a lot more network across the states or across the region that will provide a broader scope and maybe some additional ideas or models or frameworks to be able to apply. So going into our threats, the biggest thing is going to be the financial mismanagement, as well as having the majority of our contracts with the county. This is great, but what else can we use as far as additional funding? We have federal funding, there's going to be grants, there's going to be collaborations with local universities. So really being able to rely on some additional contract agreements will be beneficial and financially sustainable for Healthy Community Brookfield. And the biggest threat of all is not being able to comply with Public Health Accreditation Board standards, specifically Domain 9, 9.1, and 9.2. We will get into that further, how to spearhead those standards and get us up to compliance within the year. So to start with a broader perspective, we're going to look at HCB's current mission and vision, and then maybe a new or proposed mission that is more straightforward, direct, and easily understandable by the community. So right now, HCB's current mission is fairly lengthy for a one-sentence phrase. I was looking to shorten that and kind of give more of the how for the operation, so kind of expanding on what they said, but still kind of keeping it short. Through community partnerships and engagement, ongoing education and access to programs and services, HCB strives to improve Brookfield community residents' health and wellness. Still kind of long, but trying to keep it as short as possible. As well as with the vision, I tend to think of that as being more of our outcomes. So I see that HCB really wants it to be a nonprofit organization, so I kept that in there. But kind of shortening that just to have the community to really be able to grasp what we're trying to envision. And that is being a nonprofit organization. HCB provides positive health behaviors and improved health across Brookfield County. So that kind of really is able to encompass all of the residents of Brookfield County, which HCB does provide services for. So getting into our strategies and actions, we're going to spearhead the compliance with the PHAB, Public Health Accreditation Board standards, specifically for Domain 9.1 and 9.2. At the end of this presentation, I have a reference page with the link right to their standards for anyone that wants it. But one is we're going to be focusing on the performance management system, as well as the quality improvement process, neither of which Healthy Community Brookfield has had in place. So we're going to start to implement policies and procedures to kind of get ourselves up to compliance with those standards. During which we want to evaluate how we implement those policies and procedures, just to make sure that it is going to be efficient and that it is going to be streamlined and it is going to make things better quality and more effective overall. And then after that, we will be evaluating the results of what we have found. So doing the data collection and really bringing that back about our actual programs and services, not just the implementation of the process itself. And finally, this last strategy is to recruit a financial analyst, which HCB is in dire need of, as you can see over our trends and we've described, but even possibly having them on the board of directors, just to continue our development and progress financially and throughout all of our programs. All right, so getting into the action plan. So the action plan really takes those strategies and breaks it down as the what, who, duration or time frame, resources, and barriers expected throughout trying to implement all of those strategies. So this really reviews, the responsibility, the timing, the human and financial resources needed, as well as any mitigation for community partners that may be needed along the way or in the long-term view. So to get started, I combined the 9.1 and 9.2 That's the performance management system, as well as the quality improvement process. So who will be doing that is mainly senior management and the executive director. Um, we will be doing ongoing meetings and ongoing progress with quarterly updates, so that way we can stay up to date with exactly what's going on, as well as an annual review to help us comply with those. We will have our annual review with PHAB anyways, but scheduling those and keeping on top of that for the next year, and then going on annually for at least the next 4 years is very important to maintain our PHAB standards, as well as resources. So time, manpower for our weekly planning meetings, like once a week, just to be able to plan and to continue on. That is more than welcome to have that kind of dwindle to bi-weekly meetings or once a month. But I would really like to see something weekly, regular, so we are meeting either face-to-face or via Skype telecommunications. And then anticipated barriers would be really just the time to conduct these meetings. It's going to be costly in manpower, that is paid hours. It will be costly, but it will be beneficial for the long run. So then going back to the strategy of evaluating the PMS and the QIPF. I think that is a typo. That is supposed to be QIP. That is, we are going to be assessing the procedural ease, use, and effectiveness of the implementation, as well as seeing how sustainable it is and if we have to tweak anything to kind of maintain that sustainability. That'll be mostly the senior management working with department directors as well as team leaders and managers. Again, those meetings should be ongoing, maybe monthly, to kind of keep up to date, where they see each other a little more on the day-to-day operations, as well as having an annual review with us as well as with PHAB. And again, the biggest resources and barriers is going to be time and manpower, as well as when we're working with the daily operations and the direct service level staff, maybe some friction regarding procedural changes. So really being able to work with them, have the time to provide team trainings or individualized trainings to really help everyone understand why we're making these transitions, how to do it, the step-by-step process. Just being able to work with our employees and not expecting all of them to be able to get it right off the bat and have it be absolutely perfect. We're keeping in mind we're implementing this with our daily operations already in effect, creating a little bit of more stress. And the last strategy is to recruit a financial analyst for the board of directors. I'd love to hear your input on this, but I would hope that they would be able to recruit them and have them assess the financials and the data of the PMS and the QIP. It would be them, myself, and you, the board of directors, working together as a team to kind of get all of that together and support the financial analyst with anything that they need to kind of help support HCB. Ongoing meetings, as well as you can see there's a breakdown for how we can kind of phase out our frequent meetings to kind of ease up on time, but still spearheading it for the first year. Really making sure we meet those compliancy standards. Additionally, it's going to be, again, the funding, the manpower, the financial compensation of paying the financial analyst, as well as maybe the urgency for a good qualified matching financial analyst. I don't want to see us rushing, hiring someone just to get someone in there. I'd like to find someone that is a really good match for HCB and for us as a board of directors. So how do we know all this works? How do we evaluate all of this and see if it's actually effective? Well, having a detailed and dashboard overview of our financial status, the progress, any limitations. That'll be huge for agenda and time management, as well as collect employee and community data to really get an overview of the community perspective of how the community performed. So, what can you do? What can we do? We can recruit a financial analyst, attend bi-monthly senior management meetings, keep these meetings ongoing, have an agenda, stick to the agenda, meet with the employees, meet compliance. We can work together to do this. I know we can. It's nothing we haven't done. So thank you for your time. I am open to suggestions. And any questions?